right, let's go over your payday terms first, and then we'll kind of get going. So the next 3 weeks, this week, next week, and the next, we'll be going over vital signs. So you guys are going to learn how to take vital signs, just the main ones. We're not going to go into any like great depth, but we'll look at assessing respirations and heart rate, blood pressure. Blood pressure is kind of a tricky one, so we'll learn how to do manual blood pressures. Once you get the hang of it, it's really simple. It just sometimes it takes a little while to get the hang of it. So we'll be doing that. Let's look at vital sign. This new payday terms first. All right, so palpate says this is to assess by feeling or touching. So like you palpate a pulse. Okay, you palpate, like if somebody has something, if you've ever been to the doctor and you hurt something and they feel on, like let's say you hurt your arm and they're feeling on it to see if it's swollen or see if there's something out of place, that's palpating. Auscultate is to assess by listening. So use a stethoscope to auscultate. Okay. Makes sense? Assess is to evaluate the condition of something. So if I'm giving an assessment, okay, that is an evaluation. I'm assessing, I'm just checking on it, looking, evaluating the condition of it. Stethoscope, this is the instrument that's used to listen to body sounds with the earpieces. We'll talk about the different parts of the stethoscope as we go. But there's more than just, you know that they listen to your heart. You can listen to lungs. You can also listen to somebody's belly and make sure that their digestive system is working the way it needs to, or if it's working too much. Respiration. This is one complete breath, so that includes inhalation and exhalation. We talked about that before, but breathe in and breathe out. That's one respiration. Apical. This is the location of the pulse that can be found near the heart. So when you're thinking about heart's kind of the lower right-hand side, but that's where you listen with the stethoscope. There's actually different places you can listen, but that's the apical pulse. And you can actually feel a pulse there too, up on your ribs. Tympanic, this is pertaining to the eardrum. Your tympanic membrane is your eardrum, which makes sense, right? You think of like a timpani in the band, you know, that big drum, like this big, it's got the white top on it. Excuse me, y'all. Thermo is a root word for heat. So thermometer then basically is like a thermometer, right? It's measuring the heat. Radial is pertaining to the radius. That's your arm. That's the bone that's connected to your thumb. So when you're talking about a radial pulse, that's the one that's right down from the thumb and the wrist. Rectal is pertaining to the rectum. That's talking about taking temperature, like especially in babies, use a rectal tip. That's usually the most accurate for babies and the easiest anyway. And the rest of them are abbreviations. P for pulse, R, or it could be RR for respiratory rate. Respirations and respiratory rate. T or temp can be temperature. VS is vital signs, and then SpO2 is oxygen saturation. Y'all ever been to the doctor and they use one of those little, like a little clamp on your finger, and it's red and it shines on your fingernail? That's a pulse oximeter, name of that. And it measures how well your capillaries are oxygenated, like how much oxygen they're carrying. So it gives you a percent. 100% is what you want it to be. Usually normal is anything, 95 to 100. Okay, so that's that. All right, let's go on and talk about vital signs, and hopefully we'll try to get temperature too. Excuse me. Goodness. I like this picture. Can you read it on yours? Mr. Goodness was the last time anyone checked on Mr. Clink. As well. Hopefully we don't wait that long. But all right, vital signs. So these are often considered the most important assessment that we can do. Why is that? Any ideas? Yeah, right. I mean, if you assess vital signs and you get nothing, they're just not alive. You know. But you think about it, vital sign. Vital is, right, it's necessary. They're necessary for you to be living. And that's what they do. They show the function of your main necessary organs, right? Your heart, your lungs, and those two can't work without your brain. So, yes. So it generally includes your temperature, pulse, respirations, and blood pressure. Those are kind of your main vital signs. A lot of times it's also pain is considered the fifth vital sign. You'll hear that people talk about that. And then often the oxygen saturation too. That's a lot of times because it's easy to check, something that's very accessible, and it's just easy to do. And it tells a lot also. Step one of any vital sign that we're going to do, any procedure that we're going to learn, is always going to be wash your hands. Makes sense. Okay. So the order in which you take vital signs are those four. Okay. You always go least invasive to most invasive. You remember what the word invasive means? You remember? Yeah. So, for example, for example, getting a shot versus taking a pill. And which one of those is going to be most invasive? The shot, right? It enters into the body, but it's also more uncomfortable. And so, same idea here. When you're talking about taking somebody's vital signs, you go least invasive to most invasive. And a lot of this is, think about even taking it on a child, okay? The scariest thing to a child a lot of times is blood pressure, or it could be temperature. But those are going to be the most uncomfortable. And so I don't want to do that first, or they're going to get all worked up, and then how am I going to check their respirations and their heart rate if they're crying in control? You know, it's the same thing. So least invasive to most invasive. So as long as you're doing an oral temperature, tympanic, or like a scanning temperature, then you check respirations first, pulse. A lot of times you can do those at the same time. Temperature, and then blood pressure. Even though blood pressure is not really super invasive, it's definitely uncomfortable usually. If you're doing a rectal temperature, so on a baby, then you would do your rectal temp last. Obviously, that's going to be more invasive than any of the rest of them. And then when you write them down, however, when you document vital signs, then you write them down. You don't even have to write down their abbreviations. You can just write them in order. But you always write temperature, pulse, respirations, blood pressure. TPR, blood pressure. Just remember that, TPR, blood pressure. So just like I did up here, 98.8, -92, -12, -120/70. And once you learn the normal rates, you can pick out what is what. Usually, you can pick it out anyway, but not always. So that's an example of how you can actually document someone's vital signs. And a lot of times they do it on a flow chart or a graph. How these links worked, I should have checked. Oh. See if it's coming up. Not there either. Wait. There it is. So this is one example of a flow sheet that sometimes you'll see written down. So a lot of times, especially in a hospital or in a long-term care facility, like maybe a nursing home or something like that, you'll see, and they'll have their name, and then you just keep like an ongoing chart of their vital signs in one place. So let's say I check it every morning at 7, and then every night at 7. I can write the date and time, who I am, write down their vital signs, and then come back in that evening. And what that does is whenever you have them all in the same place like that, one thing that does, one thing that does is that allows you to go back and see, okay, something, because sometimes someone's heart rate might be low, and their heart rate might just be low normally. But you don't want to automatically assume that if their heart rate's been 95 for the last 3 months, and then all of a sudden you go in one day and it's 65, even though 65 is a normal heart rate, you might be like, something's not right, something's abnormal, even though it's not necessarily, may just be abnormal for them. And that's what that flow chart does, really, is it kind of tells you if something's abnormal or not. Oh, never mind. So this is another example of a graphing chart. And what they do is I put my day up here, what time it is, and then you just chart it. So I chart right here, I chart their pulse in the first box. So if it was 90, chart it down here, and their temperature over here. And then what you can do is you can go back and kind of make a little graph chart out of it and look and see, okay, their heart rate's been steadily at 65, and then all of a sudden one day it jumps to 95. Then you have to know there's something going on. Maybe they're stressed out. Maybe they have an infection. Maybe they have something else going on that you don't know about. So that's why these just give you a flow chart, gives you an idea of where they've been and what's going on with them. All right, let's talk about pain for a second. So pain, okay, it says pain is what the patient says that it is. You can't just say, well, they don't really look like they're in pain, so they must not be in pain. You can't just assume that you know how people feel. Some people tolerate pain better than others. It's always a subjective assessment. What does that mean? Subjective versus objective.
Yes, in your opinion.
In your opinion, right? So if it's objective, that means you can see it, right? It's measurable. If I check your heart rate, John, Jamie checked it, it should be the same, right? We should get the same, or right around the same number. That's objective. Okay? And then I'm going to check Jamie's the same way. I'm going to check her heart rate the same way I check yours. And it's objective. There's a specific number that's attached to it. Subjective means that it is what they say it is. It's in their, like you said, it's their opinion. This person may have stubbed their toe and say, yeah, I mean, yeah, it kind of hurts. It's like a 2 out of 10. And the next person may come in and stub their toe and say it's the worst pain they've ever felt, ever. So You have to write down what people say whenever you document someone's pain. Now, if I go into someone's room, here's what happens. When you have pain at a certain level, so let's say you give them a verbal scale, say 0 to 10. 0 is no pain, 10 is the worst pain you can ever imagine. Where would you say your pain is today? And they're like, oh, my pain's like an 11. It's the worst ever. But then they're like laughing and cutting up and dancing in their room, okay? You may think, okay, they're not really in pain, but you can't go with that. You have to go with what they say. So I would document, patient reports pain is 11 on the scale of 0 to 10, worst pain ever, period. Patient currently standing up, dancing in their room with their family members and laughing and whatever. So I would document everything that I see. Otherwise, it's going to be, why didn't you treat their pain? Why didn't you give them some pain medicine or whatever? So you always have to document. But anyway, so there's a few different pain scales that we use. Oh, it can't be found. A Long Baker scale is actually a number. I'll give you guys one. I'll show you. Goodness, can't breathe today. All right, so a Long Baker Faces scale is this one here on the left, and it I don't think it can be seen on there. Can't see the video. Anyway, see, kind of dark in here. Anyway, so when you look at it, it says there's like different faces over here. So doesn't hurt at all, hurts a little bit, hurts a little more, hurts even more, hurts a whole lot, and hurts the worst ever. Now, this is usually used on a kid that can't really place their pain on a number scale. So up into elementary, you could use that, or maybe if a patient is nonverbal, like an older patient can't speak, you can have them point. And you don't just put this up to them and say, your face looks like it's about a 6. It doesn't work like that. You have to have them point. So it's not for babies. They have to be able to say, like if I went to Hannah and said, Hannah, I know your foot's hurting. Can you point to which picture that shows how you feel right now? So, and then they point to it, and that's how you get that number. A numeric pain scale is just like your verbal analog scale. 0 to 10. 0 being no pain, 10 is the worst pain you can ever imagine. Where would you say your pain is right now? That's what I would say to you guys. All right. Okay, a flat scale is for infants and really young children that are too young to use a FACES scale. Oh, how is it gonna work? You know what? But a FLAC scale is an acronym, so it may work, it may not. Oh, yeah. Is there a FLAC scale in here too? No. Let's talk about it. So a FLAC scale is a scale of 0 to 10, and you look at different areas. Let me see if I can find one real quick. There's a picture of one on here. Okay, here's a flag scale. So you look at face, legs, activity, cry, and consolability. So if I was going to look at Micah, 1.5-year-old, this is what I would use. I'm trying to figure out pain. So that it gets 0 for no expression or no smile or whatever. They get a 1 if they're frowning, withdrawn, or if they're not interested. Like you can't, they're not, participating in your conversation, if you will. Or clenched jaw, frequent quivering chin. That's a 2. Legs, if they're normal, they get a 0. If they're uneasy or restless or kind of tense, they might get a 1. But if they're kicking or if their legs are drawn up, then they get a 2. And it goes the same way. Activity goes from doing nothing to like jerking or arched or rigid. Cry, no crying, all the way up to screaming. And then consolability, as in they're happy, or you can't even, like you pick them up and they can't even be calmed down. And so what you do is once you circle these on this pain score, then you just add them up, and that's how you get your 0 to 10. So that's another way to check pain on a baby that's not big enough to point to a face that tells how they feel. This one is for like an adult who's maybe nonverbal, or they've had some kind of, they've had a stroke or some other kind of disease that has really debilitated them. You might use something like this. This one's not necessarily one that's used everywhere, but it's probably one for this facility or something that'll work. May not. My links are all let me navigate them, I guess. Well, anyway, but it would be kind of like that flag scale, same idea. Same idea. You look at how are their muscles tensed up, like do they respond when you talk to them, things like that. All right, so some things that you're looking for in a pain assessment. If you look at the back of this card, it goes over PQRST. There's another one you can follow too, whatever. So this is how you assess someone's pain. So let's say Jamie fell down and sprained her ankle yesterday. Okay, so I would say what makes it work? What P is provokes or point, like the says location, from location. So what makes it worse? Probably walking on it, moving it, and then point to the location. That gives you an idea. Q is for quality. That means how does it hurt? Like what type of pain is it? What does it feel like? That's what you would ask. Sometimes it's really hard for people to tell you that, but you say, how would you describe the pain? And that's the quality of the pain. Is it burning? Is it throbbing? Is it like a pinprick? Is it sharp pain? Is it a dull pain? Is it ache? Is it sore? Is it, what is it? Is there an intense pressure? What does it feel like? Is it constant or intermittent? Is it all the time, or does it just happen when you move it? Whatever. R is for radiation or radiates, or this one says relief. So does it move, right? We talked about radiating pain with the heart attack, that radiates to your jaw or to your arm. So does it go anywhere else? Does it shoot up if you've got your ankle? Does it shoot up your leg, or down to your foot? Does anything make it better? Severity is how bad does it hurt? That's when you use your number scale. 0 to 10. Where's your pain right now? 0 is no pain, 10 is the worst pain you can ever imagine. S and S is also signs and symptoms. So is there anything else associated with it? Is it swollen? Is it, does it whatever else you can think of. And then the last one is time. So when did it start? How long has it been going on? So those are ways to assess pain if you're asking, you know. And that's usually something that has to be asked. Every time you do vital signs, you also ask about pain. All right, let's go ahead and talk about temperature because I want to get through this since you guys will be here tomorrow. Let me go ahead though and